The broadcast is now starting. All attendees are in listen-only mode.
Well, good evening, and welcome to another edition of Question Lab. I'm your host, Jeff Downing, here to serve you up another platter full of USMLE-style questions. And tonight, we're going to focus on things that you may have forgotten. So we're going to tell you a little bit more about tonight's special edition. And to do that, I am going to introduce my co-host, Sean Nanji. Sean, would you like to introduce yourself?
Sure. My name is Sean. I've been with USMLE-Rx and RX coach for over 3 years now, working with students individually and our coaches to help them on their academic journey. Tonight's topic is a combination of 4 questions from different subjects of things that you probably knew really, really well when you learned it in medical school, but things that are easy to forget. So just a reminder for some high yield topics.
What we're going to do is, again, we're going to kind of walk you through our methodology. It is based on the methodology used by RX Coach. So we're going to talk a little bit about RX Coach later in tonight's broadcast, but the main thing for us is that there's a lot you have to study in med school. There's 40,000 plus facts that you essentially need to absorb within, the first 2 years. And, being able to, extract that information and to synthesize that information that's the real gift. And it's the thing that you're going to be tested on test day. So, what we do here at Question Lab, mirrors some of the techniques we use with RX Coach. So what we're going to do is we're going to get into the first question, and when I reveal it, you're going to see something that's might be a little bit odd for especially if you're a newbie here, and that's you're not going to see any answer choices. So think about this, as we go through this is our method, and this is a method that's been used by, hundreds of successful RX Coach students, as well as, lots of med students, over the years. We advise you to cover up those answer choices first and foremost. And the reason we say that is because we don't want you to be distracted or disoriented by an answer choice that you either are unfamiliar with, or you can't remember, or is something that you've struggled with. We really want you to be able to focus. So having a method and following that method on each question, it's going to allow you to be methodical, right? It's going to allow you to not have to think about your plan for the question, but just execute on that plan. So we say cover up those answer choices. And then step 2 is read the lead-in first. Now, the lead-in is the actual question part of a QID, of an item. And in this case, the lead-in is, which of the following best represents the probability that the child will be affected by cystic fibrosis? So, we want you to read the lead-in because it's going to help cue you in on what are the, what kind of information are you looking for when you're looking at the vignette. It's very rare these days, but it does happen occasionally on step 1, where the lead-in is really all you need in order to answer the question. Sometimes that that used to be a little bit more widespread, but a little bit more rare. But if you read that lead-in first, now you're going to be able to say, oh, okay, well, I've got I know that that we're going to be looking for something probably in the world of genetics, right? So with that, we've read the lead-in. Now we're going to read the vignette. A pregnant couple comes to the physician for genetic counseling. The father is a known carrier of the cystic fibrosis PHE508 gene mutation. The otherwise healthy mother has not been tested for genetic mutations. She has 2 healthy parents and a brother with CF. So again, the lead in, which of the following best represents the probability that the child will be affected by cystic fibrosis? I'm going to turn it over to Sean here in a second. What I'd like you to do is head down to the question box and let us know how many steps you think it will take to solve this question as I turn it over to Sean. Sean?
Well, thank you very much, Jeff. We're going to go ahead and show you what we believe are the important clues in the vignette and lead-in. There we go. So as you can see here, the father, it says it's a cystic fibrosis gene, so we know he's a carrier. Mother, not been tested. 2 healthy parents, brother with CF, and we're looking at the probability of cystic fibrosis here in this person. So, you know, odds are it's probably just a 1 or 2 step question. You just gotta, you know, figure out where the genes are coming from, do some math, and see what the probability is. So I know medical students love math, so let's go ahead and uncover those answer choices. And when we look at the answer choices, you know, we like to start from E and work our way up to A, right? And the reason we do that is because we don't want you to see an answer choice that you're unfamiliar with that may cause you to panic. Or, you know, what a lot of students will do is they'll start at A and go down and pick what they think is right and then forget to read or fail to read the rest of the answer choices. So we want to make sure that you're taking a look at all of them. So let's take a look at those now. E, 50%, D, 3%, C, 25%, B, 17%, and A, 100%. So we're going to go ahead and open up that poll and give all of you some time to select your answer.
That we will. Thank you, Sean. And so it's time to literally do the math. Go ahead and let us know which of the following best represents the probability that this child will be affected by cystic fibrosis. We'll remind you throughout that on test day, you never want to leave a question unanswered. Even if you don't have a clue, you're not going to get penalized for it. You might get lucky. So make sure that you know you're keeping an eye on the clock and that you're answering every question in every block. And you definitely want to answer every question here during Question Lab. If you're going to get it wrong, this is the time to get it wrong. We're here to learn. We're here to improve. So let's see, we've got about 70% of you have voted. I'm going to go ahead and close the poll, and we're going to see if everyone's calculator is working properly. We'll share these results. So looks like the vast majority of you went with answer choice C, 25%. Some of you thought answer choice E at 50%, and then some of you are thinking that maybe it's 17%. Okay, so we'll hide the results and reveal the answer. And the answer is answer choice B, 17%. So the vast majority of you went with answer choice C and 25%. This was the 3rd place vote getter, so very interesting. Let's turn it over to Sean here and have him break it down for us.
Well, thank you, Jeff. So, you know, first and foremost, we need to think about cystic fibrosis and what the inheritance pattern is of that. And so we must remember that cystic fibrosis is an autosomal recessive disorder. That means that a person must receive a mutant allele from each parent to be affected, okay? So that being said, let's take a look at the father and the mother. So the father is a carrier of the mutation, but does not have the disease. So because cystic fibrosis is autosomal recessive, he must have 1 mutant allele and 1 normal allele, which means his chance of passing along the mutation is 50%. Okay, so we have that set aside. Now, we don't know the mother's genotype. Her brother's phenotype as having cystic fibrosis can be used to kind of figure that out. So based on the fact that cystic fibrosis is autosomal recessive, her parents must both be heterozygous carriers, which means one normal allele and one abnormal allele. Now, because she does not have the disease, as in she does not have two abnormal alleles, she has a 2/3 chance of being a carrier, which is 67%. So because her chance of having the mutation or being a carrier is 67%, and those who are carriers of the mutation have a 50% chance of passing the gene to their offspring, her chance of passing the mutation to her child would then be 67% times 50% of passing it on, which is a total of 33%. Now I'm going to repeat that because I know, there was a lot involved there. Okay, so how are we getting to that 67%? We're getting to that because, like I said, we don't know the mother's genotype, but we know her brother's phenotype as having cystic fibrosis. He has CF. So based on the fact that cystic fibrosis is autosomal recessive, right? That means her parents must both be heterozygous carriers, which means they must have one normal allele and one abnormal allele, which was passed on to the son, her brother, which then led to him having cystic fibrosis. Because she doesn't have the disease, that means her odds of being a carrier are 67%. Okay, that means she's got she's got a 2/3 chance of being a carrier. So because her chance of having the mutation is 67%, and those who are carriers have a 50% chance of passing on that gene, we take the 67%, multiply it by 50%, and we have 33%. Now, regarding the couple's chance of having a baby with cystic fibrosis, the probability of the two independent events, which means one coming from the mother and one coming from the father, right? So we have 33% from the mother, right? And then we've got from the father, right? So if we take the father's chance of passing it on and the mother's chance of passing it on, and we do the math there, we end up with 33% times 50%. So 33% the mother's chance of passing it on, 50% of the father's chance passing it on. We do the math and we're left with 17%. Okay. So, these are things that, we probably did back in, or you're doing it now if you're new in med school, or definitely did it when you first started. And we were probably pretty good at it then, or at least remembered how to do it. But things, as we move on to different subjects, we don't really revisit genetics a lot. So we wanted to kind of jog your memory here and let you know how to do that so you can get it right on tested, because these are going to be easy points and you will have a couple of these. So let's take a look and see why the other answer choices are incorrect. 50%. Well, that would be the risk of the child being affected if one parent is affected with an autosomal dominant disorder. So that's why you have to realize that this was an autosomal recessive disorder in order to even have a chance of getting this right. 3%. 3% represents the approximate risk of offspring being affected by multifactorial genetic disorders, and that's not what this is either. Okay, 25%, that's what most of you selected. This would be the correct answer if both of the parents were heterozygous, as in known carriers for the disease allele. You'd have 25%. But remember, we had to do the math to figure out the mom's probability, and then kind of work backwards from there. So that's why C isn't right. But if they were both heterozygous for it, then that would have been the correct answer. However, that is not the case. Okay, 100% is definitely not the correct answer, because that would be children of mothers who are affected by diseases of mitochondrial inheritance, and so that would be 100%. But we're not looking at mitochondrial inheritance here. So a challenging question to start off our night, but great job, everyone. And let's move on now to question number 2.
Excellent. Thank you, Sean. So again, perfect example right here of, the kind of thing you may have, may have known and, during your first year, and kind of atrophies over time. So glad we could dust that off for you. So let's go to question number 2. Again, we've got the answer choices covered up again, and we're going to start off by reading the lead-in. Which of the following mechanisms is used by the toxin most likely responsible for this patient's symptoms? Okay, so you kind of study that lead-in, get a sense of, okay, I'm looking for mechanisms, and that there's something that connected to a toxin here. So you can kind of frame it as we get ready to read the vignette. 12-year-old girl is brought to the emergency department because of bloody diarrhea for the past 3 days. Her symptoms began after eating a home-prepared hamburger. Her temperature is 38.3, pulse is 125, respirations are 16, and blood pressure is 125/70. Physical examination shows petechiae on her extremities and chest. Lab studies show hemoglobin 9, leukocyte count 12,000, platelets 50,000, prothrombin time 12 seconds, partial thromboplastin time 33 seconds, fibrinogen 327, serum creatinine 2.3, lactate dehydrogenase 120. The patient is successfully treated with supportive care in dialysis. Okay, so with all of that, let's read that lead in one more time. Which of the following mechanisms is used by the toxin most likely responsible for this patient's symptoms? And once again, I'm going to ask you to head down to the question box. Let us know how many steps you think it's going to take for someone to arrive at the right answer as I pass it on to Sean.
Well, thank you, Jeff. We're going to go ahead and take a look now at what we believe are the important clues in the vignette and lead-in. So, I didn't highlight too much in this one. 12-year-old girl, emergency department, bloody diarrhea, 3 days, had a home-prepared hamburger, and we're looking for the mechanism that is used by the toxins. We're likely looking at a two-step question. We've got to figure out what the disease diagnosis is and then what the disease mechanism is, right? And so you've got some pretty good buzzwords there, and those few highlights there should be enough for you to get to that correct answer. So let's go ahead and take a look at the answer choices. E, superantigen binding to MHC2 protein and T cell receptors. D, overactivation of adenylate cyclase. C, increasing the release of acetylcholine. B, inactivation of ribosomes. And A, inactivation of elongation factor 2. So we're going to go ahead and open up that poll and give all of you a few moments here to lock in your answers. The poll is open.
Sorry,
so generally we wait until about, there we go. There you go. All right.
I was talking with the mute button on. Sorry about that. Yeah, so again, that last answer choice is it's supposed to end T cell receptors. We have a character limit here within our quick poll, but I'm sure that all of you have that figured out. Let's see, about 60% of you have voted. I'll give you a few more seconds and then we're going to get ready to close the poll. So go ahead and register your answer choice. Okay, let's go ahead and close the poll. And let's see what you guys are thinking. So interesting. We've got a pretty even spread across the board. I mean, we've got inactivation of ribosomes and overactivation of adenylate cyclase is tied at 27%, with superantigen binding to MHC2 protein and T cell receptors at 25%. So really tight here. So the only answer choice that didn't pull any votes is answer choice C. So let's go ahead and hide the results and reveal the answer. And the answer choice, correct answer is B, inactivation of ribosomes. So it tied for first, so we're gonna give everybody the benefit of the doubt. It's a win for the Question Lab audience. Nice work, everyone. If you didn't get it right, that's okay. Sean's gonna help walk you through this. Sean?
Well, thank you very much, Jeff. So, we're looking here at hemolytic uremic syndrome, and I always have that mnemonic HUS for hemolytic uremic syndrome, or hamburger undercooked got sick, right? So this patient ate a hamburger and then got sick. So what can cause HUS. Well, HUS can be caused by E. coli and Shigella, and HUS is going to be characterized by bloody diarrhea, acute renal failure, and thrombocytopenia. And HUS is due to bacterial secretion of protein toxins that will enter your intestinal cells, and they inhibit protein synthesis by binding to ribosomes. So how do we know it's HUS? Well, we've got the bloody diarrhea, right? We see the fever, the tachycardia, the petechiae, but the hamburger was really your biggest clue, right? And if you look at the labs, you see an elevated white blood cell count, decreased hemoglobin, which is concerning for anemia. And HUS, like I said, is most commonly associated with undercooked beef. So now we're thinking what causes it. We know that it's either Shigella or E. coli, and both of those express the Shiga toxin. Okay, and so whenever you see HUS, right, you're going to see a triad. The triad is going to be hemolytic anemia, renal failure, thrombocytopenia. And so now that we know it's HUS, right, and like I said, the hamburger was a big clue. And anytime you see hamburger on a test, I want you to start thinking about HUS and look for that triad. If you see that triad, it's most likely HUS, but your mind should start going there, okay? So now that we know that, we have these Shiga toxins, and what do they do? Well, Shiga toxins, like I said, enter intestinal cells and they inactivate ribosomes, which then will stop protein synthesis, okay? And as a result, we're going to have renal failure, microangiopathic hemolytic anemia, and DIC, as well as thrombocytopenia and fever. So, in order to get this right, we have to realize that it's HUS, realize what causes HUS, and then see the mechanism. So, something that you probably learned in med school or probably learning now, one of those things that, a lot of us know HUS, but remember, the test writers can take a topic that we know very well and then take it a step or two further to really test our ability to apply the knowledge that we've learned. So this is a really good example of that. So let's take a look at the other answer choices and see why they're incorrect. E, super antigen binding to major or to MHC2 or major histocompatibility complex 2 protein and T cells. That's really used to describe toxic shock syndrome, and that's caused by Staph aureus. So that's why that answer is incorrect. Overactivation of adenylate cyclase, that's describing the toxin that's produced by Bordetella, which causes whooping cough. And we're not looking at whooping cough here, okay? So that's why that answer is incorrect. C, increasing the release of acetylcholine, that's going to be the venom that's produced by Latrodectus or the black willow spider. And that's going to, anytime you see acetylcholine, you're going to really start seeing muscle-related issues, okay, or paralysis. And we're not seeing that here either, which is why that answer is incorrect. B, we talked about, that was the correct answer. Inactivation of EF2, that's the exotoxin of Corynebacterium diphtheriae, which will eventually lead to cell death. But this patient does not have diphtheria, okay? So, if you knew HUS, you could have gotten to the right answer by going a step further, but also some of these answer choices could have been eliminated if you knew what they belong to. So a good reminder here to pay attention to your buzzwords in micro. And First Aid does a really good job of that. So take a look at some of those charts, and I think you'll find them really helpful. Back to you, Jeff.
Excellent. Thanks, Sean. Yeah, good work, everyone. Again, this is one of those items you may have forgotten. Hopefully, this little review will be helpful for you. So we are halfway through tonight's session. We're going to have a raffle at the end of the evening, so make sure you stick around. You do need to be here in order to win. But what I'd like to do right now, just pause for a second, because some of you may be thinking about you may have step 1, or you may have Comlex level 1, you may have CBSEs coming up, and thinking about the need for perhaps some one-on-one assistance. So, Sean, why don't you tell us a little bit about RX Coach and how it's been structured to help students do their best on test day?
Yeah, absolutely. So we have students that come to us all the time, and one of the most commonly asked questions that I get via email, and we get even during question lab, is, related to, hey, study plan. Can you help me come up with a study plan? And a lot of students, I think, are under this impression that there's like one magical study plan out there that's like universal that they can use, and once they have it, they'll be golden. And that's right. A study plan can help, and having a good one is very important. But your study plan is likely going to be very different from the study plan of your peers and colleagues. And the reason is because we all have different strengths, different weaknesses, right? We learn different ways. So, and we learn at different speeds and paces, right? So a study plan that works for your friend may not necessarily work the best for you. So one thing we do here is we give you an assessment, and based on the assessment and your learning style, we help you come up with a personal study plan. We do this personalized study plan with you. So your tutor might say, okay, based on the data we're seeing, we want to start you with subject X or subject Y. Let's say that subject is cardio or micro, whatever that subject is. So we'll give you a study plan for that topic based on the resources you have and the resources that we will give you access to, which includes our suite of products with USMLE-Rx and Rx360. So you'd get our Express videos, our flashcards, and of course, access to Rx bricks and our question bank, right? And then once you finish reviewing that topic on your own and implementing a study plan, you meet with your tutor to review that topic. You'll review that topic, be able to ask any questions you have from your tutor, and then you'll do practice USMLE-style questions together to make sure that you can apply what you've learned. And as you're talking out loud and speaking with your tutor, we'll be able to identify any knowledge gaps that you may have and bridge them, but also work on your test-taking skills at the same time. So we really do it on all fronts, which is why we've had so much success with RX Coach, and all of our students so far have been successful. So if you're interested in being a part of RX Coach and working with somebody one-on-one to help kind of take the guesswork out of studying, make your study more efficient, and help you get to where you want to be, reach out to us at rx-coach.com. We do have a free consultation that's designed to discuss the tutoring program and how it can benefit you. So if you're interested in learning more about RX Coach, that free consultation is available at rx-coach.com.
Excellent. Thanks, Sean. Let's head to question number 3. So, as before, we're going to cover up those answer choice and start with the lead-in. Which of the following structures is most likely being compressed by the abscess? Okay, so the lead-in has already set it up. There's an abscess here, right? Knowing a little bit about what you're looking for, let's read the vignette. A 10-year-old boy is brought to the pediatrician with a 4-day history of fever, fatigue, and right shoulder pain. His temperature is 38.6 degrees Celsius. On physical examination, he has right shoulder tenderness, worse at the right axillary region, and painful and weak abduction. On palpation, a swollen mass in the axillary region is noted. He also has wrist extension weakness and triceps hyporeflexia in the same limb. Sensory examination reveals absent sensation to light touch over the right shoulder and lateral and posterior arm. Imaging identifies an abscess in the right axillary region. The most likely diagnosis is an abscess. So which of the following structures is most likely being compressed by the abscess? Think about that. Hit over the question box. Let us know how many steps you think it'll take to solve this one as I pass it over to Sean. Sean?
Well, thank you, Jeff. So we're going to go ahead and go to the next slide and show you some of the important clues in the vignette and lead in here. As you can see, it's a 10-year-old boy. Always take a look at those demographic information. So 10-year-old boy, 4-day history, fever, fatigue, right shoulder pain. Temperature 101.5. Right shoulder tenderness worse in the right axillary region. Painful and weak abduction. Swollen mass in the axillary region. Wrist extension weakness. Triceps hyporeflexia in the same limb. Absent sensation to light touch over the right shoulder and lateral posterior arm. So we see an imaging here, abscess in the right axillary region. Most likely diagnosis in abscess. Which structure is most likely being compressed by said abscess? So we're going to go ahead and take a look at those answer choices. Answer choice E, radial nerve. D, posterior cord of the brachial plexus. C, medial cord of the brachial plexus. B, lateral cord of the brachial plexus. And A, axillary nerve. So we're going to go ahead and open up that poll and give you a moment to lock in your answers.
Okay, everybody, the poll has been launched. You've got 5 structures to choose from here. Go ahead and pick the one you think is being compressed by the abscess. Most likely being compressed by the abscess. Overall, let's see, we've got votes coming in fast and furious for this one. This is great. Like we said, we'll have the raffle here at the end of tonight's session. We'll have a special code for those of you in need of a bit of a discount for USMLE-Rx products. Quick note for our USMLE-Rx users, the first aid rollover is going to occur. It's scheduled to occur on Thursday morning. So basically just means the 2023 edition of first aid will get loaded in. All of that content will get loaded into USMLE-Rx. So if you've got RX 360 Plus, you'll have access to all of of that content. If you just have like Step 1 QMax or with Step 1 QMax, you would get the first aid facts within the explanations. So those will all be updated for 2023. You'll still be able to choose which year you want to use within RX. So if you're using 2022 and you've got a print version of 2022 and you want to keep that all straight, you don't have to update to the new edition. Okay, let's see. We've got almost 80% of you have voted, so I'm going to go ahead and close the poll. And as before, it's a pretty good spread here. Posterior cord of the brachial plexus was the leading vote getter. A little bit over a third of you went with that one, but all of the other answer choices brought in double digits. So let's hide the results and reveal the answer. And the answer is answer choice D, posterior cord of the brachial plexus. So nice work, everyone. That was the leading vote getter, and that's a good sign here as we get closer to the end of the evening. If you didn't get it right, that's okay. We're here to make sure that you understand how to break this one down, and Sean's going to do that for us right now.
Well, thank you very much, Jeff. So once again, going back to anatomy, and when we took anatomy, and we're taking it now, there's a big focus on the brachial plexus. It's very high yield. You're going to have questions on it. But once again, if you haven't reviewed it in a while, it's quite easy to forget. So what's going on here? Well, first we got to realize, we have an abscess. Where is that abscess? Well, it's compressing the nerve supply in the to the right upper limb, right? So the structure that's most likely associated or injured by this is going to be the posterior cord, and that's because it gives rise to the axillary and radial nerves, okay? So damage to the axillary nerve will cause impaired shoulder abduction and loss of sensation over the shoulder. Once again, damage to the axillary nerve causes impaired shoulder abduction, abduction, and loss of sensation over the shoulder. And damage to the radial nerve at the level of the shoulder causes wrist drop and loss of the triceps reflex, okay? So that's why the answer is posterior cord of the brachial plexus, because of the injuries to the axillary and radial nerve here, okay? So once if you know those two nerves are involved, you're going to get this question right, and you'll pick posterior cord. But once again, it's easy to mess up with these anatomy questions. So answer choice E, radial nerve. That'll give you some of the symptoms, right? It'll help. It'll certainly account for the wrist drop and loss of triceps reflex, but it does not explain the other symptoms. So you're partly correct there. D, we talked about why that was right. Medial cord of the brachial plexus. Well, that gives rise to the median nerve and ulnar nerves, right? So if you have that, you'll have a weakness and wrist flexion, abduction and adduction of your digits, and sensory loss over your thenar and hypothenar eminences. And we're not seeing that here, okay? But remember, medial cord, always think about medial cord and median nerve, okay? Lateral cord gives rise to the musculocutaneous nerve and supplies some input to the median nerve. So injury here, you're going to have weakness with elbow flexion and supination, sensory loss over the lateral forearm, and you can have some weakness in wrist flexion, and once again, sensory loss over the thenar eminence. So once again, not lining up with the symptoms we have here. Damage to the axillary nerve, answer choice A. That's going to cause impaired shoulder abduction. So if you look here, you've got another partly correct answer there. So, you've got partly correct with A, partly correct with E, but answer choice D kind of incorporates both of them with that posterior cord injury. So great job, everyone. Let's move on now to our last question of the evening.
Okay, everybody. So we're going to work to finish strong tonight. We've got one more question for you. Again, we'll have the raffle here at the end of the evening. So everyone lock in. You know how we do it here. So all the answer choices are covered up. We're going to start with the lead in. Which of the following mechanisms best characterizes this patient's most likely diagnosis? Okay, so we've got a diagnosis here we need to figure out. Thinking about the mechanisms that characterize that patient's diagnosis. Okay, so we framed it. Now we're ready to read the vignette. A 4-year-old boy is brought to the emergency department for knee pain and swelling after a minor fall while running one day ago. He has a history of easy bruising and recurrent skin and respiratory infections. Temperature is 38.3. On physical examination, his right knee is warm and tender on palpation. He has very fair skin, white hair, and light-colored irises. So again, which of the following mechanisms best characterizes this patient's most likely diagnosis? One more time, I want you to head down to that question box. Let us know how many steps you think it's going to take to solve this one as I turn it over to Sean.
Well, thank you, Jeff. So we're going to go ahead and show you what we believe are the important questions here in the important clues in the vignette and lead in here. As you can see, we've got a 4-year-old boy, emergency department, knee pain, swelling, minor fall one day ago, history of easy bruising and recurrent skin and respiratory infections, temperature of 101, right knee is warm and tender, very fair skin, white hair, light colored irises. What mechanism best describes the most likely diagnosis? So let's take a look at those answer choices. Answer choice E, tyrosinase deficiency. D, phenylalanine hydroxylase deficiency. C, mutation of the X chromosome. B, microtubule dysfunction. And A, autoimmune destruction of melanocytes. So with that, we're going to go ahead and open up that poll and give you a few moments to lock in your answer.
Okay, everybody, so the final poll of the evening has been launched, and you have 5 mechanisms there to choose from. What do you think this patient has, and what do you think will characterize their most likely diagnosis? Okay, so we've got a little over a third of you have voted. Again, we want to make sure that you answer every choice on test day. Sorry, I may be having some connection issues on my end, so if I'm a little choppy, I apologize. Hopefully it's coming through clearly on your end. Okay, let's see. We've got 70% of you have voted, so let's go ahead and close the poll. And we'll share these results. So again, most of you were thinking either microtubule dysfunction or phenylalanine hydroxylase deficiency. But a few of you were thinking answer choices E or A. So let's go ahead and hide the results and share the answer. And the answer is answer choice B, microtubule dysfunction. So once again, leading vote getter is the correct answer. So we'll chalk one up for the group. Well done. If you didn't get it right, that's okay. Sean's here to slice and dice it for you. Sean?
Well, thank you very much, Jeff. So first and foremost, we got to figure out what's going on with this patient. What's the diagnosis? Well, we've got physical appearance. He's, light skin, pale, easy bruising, recurrent infections, and fever and swelling after a minor injury. These are all buzzwords for Chudok-Higashi syndrome, which is a rare form of oculocutaneous albinism that presents in early childhood. So once we know what the disease is, right, we got to figure out what the mechanism is. Now, Chudok-Higashi, it can also present with peripheral neuropathy and vision problems like nystagmus, photophobia, and decreased visual acuity. We don't see that here, but we do see plenty of other signs and symptoms that point us to that diagnosis. So this condition is also autosomal recessive and is characterized by abnormal cellular trafficking, and that's due to a defect in the LYST gene or LYST gene, which will then lead to microtubule dysfunction in phagosome and lysosome fusion, which then means you will not have phagolysosome formation, which will then, as a result, disrupt protein synthesis and affect the secretory and storage functions of lysosomes and different cell types, okay? So the answer here is microtubule dysfunction. In order to get to that, you need to know what the diagnosis is. And once you do that, you can get the answer correct. So why are the other answers incorrect? Tyrosinase deficiency E, that will lead to albinism. And so that's, some people might be thinking that because they saw that. However, it does not account for the recurrent infections, okay? So the recurrent infections is what's going to take you away from answer choice E. Phenylalanine hydroxylase deficiency, well, that's going to be associated with intellectual disability and seizures. And also the big clue there will be musty body odor. And you can have decreased skin pigmentation, but not quite on the level of albinism, okay? So once again, symptom profile doesn't really add up there. Mutation of the X chromosome, well, that will lead to Fragile X syndrome. And with that, you'll see microcephaly, macroorchidism, but will not account for once again, the recurrent infections, okay? So keep that in mind. We talked about microtubule dysfunction as that was our correct answer. Autoimmune destruction of melanocytes, well, that can happen. That can present with, some discoloration of the skin and that hypopigmentation. But remember, that's associated and comes and happens in vitiligo. And so what will happen is you'll have certain areas of depigmentation or even complete depigmentation. But once again, it does not account for the recurrent infection. So once again, the symptoms here, the recurrent infections, along with the albinism and the light colored irises should point you to Chudok-Higashi syndrome, and the mechanism there is going to be microtubule dysfunction. Hand it back over to you, Jeff.